Hello, everyone. In this episode, we embark on a comprehensive exploration of the intricate landscape surrounding hospital waiting times, a topic of paramount importance within the realm of healthcare. Hospital waiting times, often overlooked yet profoundly impactful, encapsulate the intersection of patient care, healthcare systems, and societal dynamics. As we delve into this multifaceted subject, we'll unravel the myriad factors contributing to prolonged wait times, ranging from resource limitations and administrative inefficiencies to demographic shifts and evolving healthcare demands. We'll dissect the far-reaching implications of extended waiting periods on patients, examining the physical and psychological toll it exacts, the potential exacerbation of medical conditions, and the consequent strain on healthcare providers and facilities. Moreover, we'll scrutinize the broader systemic ramifications, delving into the ripple effects on healthcare accessibility, equity, and quality, and the intricate interplay with socioeconomic disparities. Amidst this complex landscape, we'll navigate through potential strategies and interventions aimed at mitigating waiting times, from bolstering healthcare infrastructure and optimizing care delivery models, to leveraging technology and fostering interdisciplinary collaborations. Through insightful discussions and thought-provoking insights, I invite you to embark on a journey of understanding and exploration, shedding light on this critical aspect of healthcare delivery and its profound implications for individuals, communities, and society at large. In this captivating episode, we embark on a comprehensive exploration of the multifaceted realm of hospital waiting times, shedding light on its intricacies and unveiling its profound implications within the context of language learning. Throughout our journey, we will traverse the diverse landscapes of healthcare systems, unraveling the intricate web of factors that contribute to the prolonged waiting periods endured by patients worldwide. From the burgeoning demands of enormous populations to the nuanced intricacies of bureaucratic processes and resource allocation. We will dissect the underlying causes behind this pervasive issue, offering an in-depth analysis that seeks to foster a deeper understanding among our listeners. Drawing upon real-world scenarios and poignant case studies, we'll immerse ourselves in the lived experiences of patients and healthcare professionals alike, providing invaluable insights into the challenges, frustrations, and triumphs encountered within the realm of hospital waiting times. Moreover, we'll delve into the crucial role of language proficiency in navigating these complex healthcare landscapes, illuminating how effective communication serves as a cornerstone for fostering positive patient outcomes and driving meaningful change within healthcare delivery systems. Whether you're a language learner seeking to enhance your English skills or a curious observer intrigued by the intersection of language and healthcare, this episode promises to be a captivating odyssey, brimming with enlightening revelations and thought-provoking discussions. So, join us as we embark on this enlightening voyage where language and healthcare converge to shape our understanding of the world around us. Hospital waiting times, a pervasive concern in healthcare systems globally, are influenced by a myriad of factors that contribute to the delays patients experience in accessing medical treatment. These factors range from the demand for healthcare services and the availability of resources to administrative processes and the efficiency of healthcare delivery systems. Population growth, aging populations, and the increasing prevalence of chronic diseases have heightened the demand for healthcare services, exacerbating the strain on already stretched healthcare resources. Additionally, bureaucratic processes such as referrals, admissions, and scheduling can contribute to delays in accessing care. The impact of hospital waiting times on patient care is profound, with prolonged delays leading to increased pain, discomfort, and anxiety for patients. Furthermore, delayed access to treatment can result in the progression of medical conditions, worsening health outcomes, and even preventable complications. Consequently, addressing hospital waiting times is essential to ensure timely access to care, improve patient outcomes, and enhance the overall efficiency of healthcare delivery systems. Prolonged waiting times in healthcare settings pose significant challenges for both patients and healthcare providers, with far-reaching implications for the delivery of quality care. For patients, extended waiting times can lead to heightened anxiety, frustration, and discomfort, particularly when awaiting diagnosis or treatment for serious medical conditions. The uncertainty surrounding the duration of the wait can exacerbate these feelings, impacting patients' overall well-being and quality of life. Furthermore, prolonged waiting times may result in the progression of medical conditions, leading to worsened health outcomes and the potential for preventable complications. From the perspective of healthcare providers, managing prolonged waiting times presents several challenges, including increased pressure to accommodate growing patient volumes within limited resources. This can strain healthcare infrastructure, contribute to overcrowding in waiting areas, and lead to delays in providing timely care to patients. Moreover, healthcare providers may experience heightened stress and burnout as they strive to meet the needs of an ever-expanding patient population amidst resource constraints. Overall, addressing the challenges associated with prolonged waiting times in healthcare settings is crucial to improving patient experiences, optimizing resource utilization, and enhancing the overall effectiveness of healthcare delivery. Let's now take a few moments to consider some English vocabulary. Of course, introducing and understanding key English vocabulary related to hospital waiting times and healthcare terminology is essential for effective communication in medical settings. Here are some important terms. Elective surgery. Elective surgery refers to a planned surgical procedure that is scheduled in advance based on the patient's preference and the healthcare provider's recommendation. Unlike emergency surgery, elective surgery is not performed to address an urgent medical condition. Emergency department. The emergency department, often abbreviated as ED or ER in the United States, is a medical facility within a hospital that provides immediate care for patients with acute illnesses, injuries, or other medical emergencies. It is staffed with healthcare professionals trained to assess and treat patients in urgent need of medical attention. Triage. Triage is the process of prioritizing patients based on the severity of their condition and the urgency of their medical needs. In a hospital setting, triage helps healthcare providers allocate resources efficiently and ensure that patients receive timely care according to the severity of their illness or injury. Backlog. A backlog refers to a buildup of tasks, cases, or patients awaiting processing, or completion within a healthcare system. In the context of hospital waiting times, a backlog may occur when there is a delay in providing medical services or procedures, resulting in a growing number of patients waiting for care. Resource allocation. Resource allocation involves the distribution and management of resources, such as staff, equipment, and facilities, to meet the demands of patient care effectively. It requires careful planning and prioritization to optimize resource utilization and ensure that patients receive timely and appropriate care. Understanding these key terms related to hospital waiting times and healthcare terminology is essential for healthcare professionals, patients, and individuals seeking to improve their English language skills in the context of healthcare communication. Hospital waiting times are a critical aspect of healthcare systems, impacting patient care and resource management. Elective surgery, referring to non-urgent procedures chosen by patients, often faces delays due to limited operating room availability or staffing issues. In contrast, the emergency department, where patients receive immediate medical attention for urgent conditions, must prioritize cases through triage to ensure timely healthcare delivery. However, prolonged waiting times in emergency departments can strain resources and lead to patient dissatisfaction. Additionally, hospitals may encounter backlogs where a large number of patients await treatment or procedures, further exacerbating delays and crowding. Efficient resource allocation The strategic distribution of healthcare resources like personnel and equipment is essential for managing patient flow and minimizing waiting times. Pronunciation tips and example sentences can aid learners in mastering key terminology, so I hope that you've benefited from the application of the vocabulary discussed earlier applied in the form of some example sentences. In this next segment, we'll consider briefly various scenarios and role plays set in the context of hospital waiting times, designed to provide practical language practice for listeners. Let's consider the first scenario here, which is calling to check an appointment status. The first role will be the patient, and the second role will be the receptionist. Let's begin. Hello, I'm calling to inquire about the status of my appointment for my... Certainly. May I have your full name and birth date, please? Yes, it's James, and my date of birth is the 8th of March, 1997. Thank you. Let me check our system. Yes. I can see your appointment is scheduled for the 10th of May. Perfect. Thank you for confirming. Let's consider our second scenario now, which is discussing delays with another patient. The scenario will take place with two patients, which we'll call patient 1 and patient 2. Let's begin. Hi. Have you been waiting a long time for your appointment? Well, yes. As a matter of fact, I have. I've been here for over an hour now. How about you? Yeah, about the same. It seems they're running behind schedule today. Yeah, it's frustrating. But I hope they can call us in soon. In our third scenario, a patient will be speaking with a nurse about waiting times. The dialogue will take place between the patient and the nurse. Beginning with the patient. Excuse me, nurse. I've been waiting for my appointment for quite some time now. Is there any update on when I'll be seen? Well, I understand you're concerned, but let me check with the doctor and see if they can provide an estimated wait time for you. The final dialogue will take place in the scenario of two patients discussing an issue with each other. Hi, I notice we've both been waiting for a while. Have you heard anything about the delay? Well, not really, but I'm getting worried about missing my other appointments for the day. Yeah, I understand. Maybe we can ask the receptionist for an update on our waiting times. These scenarios simulate common language interactions and situations encountered in hospitals while waiting for appointments or procedures. Through practicing these role plays, listeners can enhance their English language skills and become more confident in similar real-life scenarios. In our next aspect, we'll explore various common situations encountered in healthcare settings, offering prompts and example dialogues to help listeners practice their English language skills. Let's continue with our scenarios. So our first situation consists of a doctor, patient I suppose, the patients discussing treatment options with their doctor. So let's imagine that we're a patient discussing these treatment options with a doctor. Doctor, I've been experiencing some discomfort lately and I'm not sure what treatment options are available. I understand. Let's discuss your symptoms and possible treatment plans. Have you considered medication, physical therapy, or surgery? Well, I haven't thought about surgery, but I'm open to exploring all options. Can you tell me more about the risks and benefits of each treatment? Yes, of course. Surgery may offer a more permanent solution, but it also comes with certain risks. Let's weigh the options together and determine the best course of action for you personally. In our second situation, we'll pretend to be a receptionist explaining wait times to a patient. Beginning with the receptionist. Good morning. How can I help you today? Well, I've been waiting for my appointment for quite some time now. Can you please tell me how much longer it will be? Oh, I apologize for the delay. We're experiencing higher than usual patient volumes today, but the doctor will see you as soon as possible. Well, I understand, but I have some other commitments later today. Is there any way that you can, expedite the process? I'll check with the medical team and I'll see if we can accommodate your schedule. Thank you very much for your patience. In our third and final situation, or scenario, we'll be expressing concerns about delays. So let's consider the perspective of a patient expressing concerns about delays to a hospital staff member. Beginning with the patient. Excuse me, I've been waiting for my test results for hours now. Is there any update on when they'll be ready? I apologize for the inconvenience, but we're experiencing some delays in processing tests due to some technical issues. Well, I understand, but I'm feeling very anxious, and I would like to know the status of my health as soon as possible, if you don't mind. I completely understand, but let me check with the lab and see if we can expedite those results for you. Through these example dialogues, listeners can practice expressing themselves effectively in common healthcare situations, enhancing their English language skills and communication abilities in real-life scenarios. Now, we'll take some time to think about the cultural dimensions surrounding hospital waiting times, shedding light on diverse attitudes, perceptions, and expectations related to healthcare access and medical urgency. Different cultures have different perspectives on healthcare access, influenced by factors such as socioeconomic status, healthcare system structure, and cultural beliefs about health and illness. In some cultures, there may be a strong emphasis on individual responsibility for health, leading to attitudes that prioritize self-care and preventative measures over seeking medical attention. Conversely, cultures with universal healthcare systems may prioritize equal access to medical services for all citizens, advocating for timely and affordable care regardless of socioeconomic status. Understanding these cultural attitudes is crucial for healthcare providers in delivering patient-centered care and addressing barriers to access, including hospital waiting times. Cultural perceptions of medical urgency can significantly impact individuals' responses to healthcare needs and their expectations regarding waiting times for medical treatment. In some cultures, there may be a sense of urgency or impatience when it comes to seeking medical care, with individuals expecting immediate attention for their health concerns. Conversely, cultures with a more laid-back approach to healthcare may exhibit greater tolerance for longer waiting times, viewing them as an inevitable part of the healthcare process. These differing perceptions of medical urgency can influence patient behaviors, healthcare-seeking patterns, and satisfaction with healthcare services. Cultural diversity plays a significant role in shaping patient expectations and communication styles in healthcare settings. Patients from collectivist cultures, for example, may prioritize group harmony and deference to authority figures, leading them to adopt passive communication styles and rely on healthcare providers to make decisions on their behalf. In contrast, patients from individualistic cultures may value autonomy and assertiveness in healthcare interactions, preferring to actively participate in decision-making and express their concerns openly. Healthcare providers must recognize and accommodate these cultural differences in patient expectations and communication styles to ensure effective and culturally sensitive care delivery. By exploring these cultural aspects related to hospital waiting times, we gain valuable insights into the complexities of healthcare delivery in diverse cultural contexts. Recognizing and respecting cultural diversity in healthcare settings is essential for promoting patient-centered care, improving patient satisfaction, and addressing disparities in healthcare access and outcomes. Navigating discussions about hospital waiting times in different cultural contexts can reveal unique cultural experiences and observations that learners may encounter. In some cultures, punctuality and efficiency are highly valued, and there is an expectation for promptness in all aspects of life, including healthcare. In such cultures, long hospital waiting times may be perceived as unacceptable or indicative of inefficiency within the healthcare system. Conversely, in cultures where a more relaxed approach to time is common, individuals may be more tolerant of waiting times and view them as a normal part of the healthcare experience. Understanding these cultural attitudes towards time is crucial for learners to effectively communicate with patients and colleagues from diverse cultural backgrounds. Cultural differences in communication styles can influence how individuals express frustration or dissatisfaction with hospital waiting times. In some cultures, direct and assertive communication may be considered appropriate when expressing grievances or concerns. leading individuals to vocalize their frustrations openly. In contrast, in cultures where indirect communication is more prevalent, individuals may express dissatisfaction more subtly through nonverbal cues such as body language or tone of voice. Learners must be attuned to these cultural nuances to accurately interpret and respond to patient feedback about waiting times. Cultural differences in perceptions of authority and trust can influence how individuals interact with healthcare providers regarding hospital waiting times. In cultures where hierarchical structures are deeply ingrained, patients may defer to healthcare professionals' decisions and recommendations without question, even if they are dissatisfied with the waiting times. Conversely, in cultures where individuals expect a more egalitarian relationship with healthcare providers, patients' autonomy, patients may be more assertive in advocating for their needs and expressing concerns about waiting times. Yes, learners must navigate these cultural dynamics sensitively, respecting patients' autonomy, while providing more empathetic and culturally competent care. By acknowledging and understanding these unique cultural experiences and observations, learners can effectively navigate discussions about hospital waiting times in diverse cultural contexts, fostering respectful and patient-centered communication in healthcare settings. Improving English language skills related to discussing medical topics and communicating with healthcare professionals in the context of hospital waiting times requires a combination of language proficiency and medical knowledge. Here are some practical tips and strategies to enhance language skills in this area. Expand medical vocabulary. Regularly review and learn medical terminology related to hospital waiting times, such as triage, consultation, diagnosis, treatment plan, waitlist, and referral. Use medical dictionaries, online resources, or flashcards to reinforce and practice new vocabulary regularly. Practice listening comprehension. Listen to podcasts, videos, or recordings of healthcare professionals discussing hospital waiting times and related topics. Pay attention to pronunciation, intonation, and word stress to improve comprehension of medical terminology and communication nuances. Role-play scenarios. Engage in role-play exercises with a language partner or instructor, simulating common scenarios related to hospital waiting times, such as discussing waitlist priorities, explaining delays to patients, or negotiating treatment options with healthcare professionals. Focus on using more appropriate medical vocabulary and expressions while maintaining clear and effective communication. Read authentic materials. Read articles, reports, or case studies about hospital waiting times from reputable medical sources or healthcare publications. Highlight key medical terms and expressions, and practice using them in written and spoken contexts to reinforce understanding and retention. Seek feedback and correction. Solicit feedback from language partners, instructors, or healthcare professionals on your language proficiency and communication skills. Actively listen to constructive criticism and incorporate suggestions for improvement into your language practice routine. Utilize language learning resources. Take advantage of language learning resources tailored to medical English, such as textbooks, online courses, or language learning apps. Participate in language exchange programs or conversation groups focused on medical topics to gain practical experience and receive guidance from native speakers or experienced professionals. The role of cultural competence. Develop cultural competence by learning about cultural norms, values, and communication styles prevalent in healthcare settings. Understand how cultural differences may impact patient-provider interactions, and adapt communication strategies accordingly to ensure effective and respectful communication with patients and colleagues from diverse backgrounds. Practicing, listening, speaking, reading, and writing in English related to medical terminology and healthcare communication is essential for improving language proficiency in this area. Comparing the experiences of hospital waiting times in different countries or regions offers valuable insights into cultural variations in healthcare systems, patient experiences, and attitudes towards healthcare access and equity. In some countries with universal healthcare systems, such as Canada and the United Kingdom, patients may encounter long wait times for elective procedures due to high demand and limited resources. However, these systems prioritize equitable access to care based on medical need rather than financial status, promoting a sense of social solidarity and collective responsibility for healthcare outcomes. On the other hand, in countries with privatized healthcare systems like the United States, wait times may vary depending on insurance coverage, socioeconomic status, and geographic location. Patients who can afford private healthcare often experience shorter wait times and greater access to specialized services, leading to disparities in healthcare outcomes and exacerbating inequalities. Cultural factors such as societal attitudes towards health, individual autonomy, and expectations of medical care also influence perceptions of wait times and patient satisfaction. While some cultures prioritize efficiency and timeliness in healthcare delivery, others may value holistic care and patient-centered approaches, shaping preferences for wait times and treatment modalities. By comparing these experiences across different cultural contexts, we can gain a deeper understanding of the complex interplay between healthcare systems, cultural values, and patient experiences, ultimately informing efforts to improve access to timely and equitable care worldwide. Understanding cultural nuances is paramount for effective communication in diverse medical settings, especially when discussing sensitive topics like wait times. Cultural nuances encompass a broad range of factors, including language, communication styles, beliefs, values, and social norms, which can significantly influence how individuals perceive and respond to healthcare-related information. In multicultural healthcare environments, healthcare providers must navigate these nuances sensitively and respectfully to ensure effective communication and promote patient-centered care. For example, in some cultures, direct communication about a medical diagnosis or prognosis may be perceived as insensitive or disrespectful, leading patients to withhold information or express reluctance to engage in discussions about wait times or treatment options. However, in other cultures, patients may expect clear and straightforward communication from healthcare providers, valuing transparency and honesty in healthcare interactions. By recognizing and respecting these cultural differences, healthcare providers can adapt their communication strategies accordingly, fostering trust, rapport, and mutual understanding with patients from diverse backgrounds. Additionally, cultural competence enables healthcare providers to tailor their language and communication approaches to meet the unique needs and preferences of individual patients, facilitating more meaningful and effective dialogue about sensitive topics like wait times through culturally sensitive communication. Healthcare providers can mitigate understandings, build stronger patient-provider relationships, and ultimately improve patient outcomes and satisfaction in diverse medical settings. For individuals aiming to bolster their language skills concerning hospital waiting times and medical English, various resources can be immensely beneficial. Firstly, medical dictionaries specializing in areas pertinent to healthcare, such as surgery, emergency medicine, or general practice, provide comprehensive coverage of medical terminology, aiding learners in grasping complex concepts relating to hospital waiting times. Online courses dedicated to medical English and healthcare communication offer structured learning platforms, interactive modules, and practical insights into effectively communicating in medical settings, including discussions about wait times. Additionally, healthcare simulation apps offer immersive virtual scenarios, enabling learners to practice real-life interactions with patients, physicians, and other healthcare professionals, thereby honing their language proficiency in the context of hospital waiting times. To optimize the utility of these resources, learners should adopt a multifaceted approach to language acquisition, encompassing activities like reading medical literature, listening to healthcare podcasts or lectures, engaging in role-playing exercises, and participating in language exchange communities or forums. Consistent practice and exposure to authentic medical content are crucial for enhancing language proficiency and confidence in discussing hospital waiting times and healthcare communication. Moreover, learners should actively seek opportunities to apply their language skills in real-world medical environments, such as volunteering in hospitals or shadowing healthcare practitioners, to further reinforce their linguistic abilities and deepen their understanding of medical terminology and communication practices. By leveraging these language learning resources effectively, learners can significantly augment their language proficiency and communication skills pertinent to hospital waiting times and medical discourse. To maximize the effectiveness of language learning resources and improving proficiency in discussing hospital waiting times and healthcare communication, learners can implement several strategies. Set clear goals. Define specific language learning objectives related to hospital waiting times and healthcare communication, such as mastering relevant medical vocabulary, improving fluency in patient-doctor dialogues, or enhancing comprehension of medical literature. Utilize interactive features. Take advantage of interactive features offered by online courses and healthcare simulation apps, such as quizzes, exercises, and simulated patient interactions, to actively engage with the material and reinforce learning. Practice active listening. Listen to audio recordings or podcasts featuring medical discussions or patient consultations to enhance listening comprehension and familiarize yourself with authentic medical dialogue. Review and repeat. Regularly review and revisit key concepts, vocabulary, and dialogues to reinforce learning and solidify understanding. Repetition is essential for retention and mastery of medical terminology and communication skills. Seek feedback. Solicit feedback from peers, language partners, or instructors to identify areas for improvement, and receive guidance on refining language usage, pronunciation, and communication strategies. Immerse yourself. Immerse yourself in medical English materials, such as medical journals, textbooks, or online articles, to expose yourself to a wide range of medical terminology and communication styles used in discussions about hospital waiting times. Participate actively. Engage actively in discussions, role plays, or case studies provided in language learning resources to apply newly acquired language skills in practical contexts and develop confidence in communicating about hospital waiting times. Create flashcards or vocabulary lists. Use flashcards or create vocabulary lists to memorize and review medical terms and phrases related to hospital waiting times, enabling quick and easy reference during conversation or written communication. Imitate native speakers. Listen to native speakers or proficient English speakers discussing medical topics and emulate their pronunciation, intonation, and communication style to improve fluency and naturalness in spoken English. Stay consistent. Dedicate regular time and effort to language learning activities, whether it's daily practice sessions, weekly language exchange meetups, or periodic review sessions, to maintain progress and gradually build proficiency over time. By incorporating these tips into their language learning routine, learners can effectively utilize available resources to enhance their language proficiency and confidently discuss hospital waiting times and healthcare communication topics. In this episode, we delved into the complexities surrounding hospital waiting times and their profound impact on patient care and healthcare systems. We explored the factors influencing waiting times, including population growth, resource limitations, and administrative inefficiencies, and discussed the challenges they pose for patients and healthcare providers alike. Through a thorough examination of key English vocabulary related to hospital waiting times and medical terminology, listeners gained a deeper understanding of the language used in healthcare settings and its relevance to effective communication. We offered practical tips and strategies for improving language proficiency in discussing medical topics and communicating with healthcare professionals, emphasizing the importance of cultural competence and language skills in navigating diverse medical environments. Furthermore, we highlighted the cultural nuances inherent in discussions about hospital waiting times, underscoring the significance of understanding diverse perspectives and communication styles to enhance language learning and communication skills. Ultimately, this episode provided listeners with valuable insights into the intersection of hospital waiting times, language learning, and healthcare communication, empowering them to engage more effectively in discussions about this critical aspect of healthcare delivery. I really encourage listeners to further explore the topic of hospital waiting times and to actively engage in discussions about healthcare access and patient care in their daily lives. By continuing to practice their English language skills in real-life situations, such as communicating with healthcare professionals, advocating for their own healthcare needs, or participating in community health initiatives, listeners can deepen their understanding of medical terminology and healthcare communication while contributing to positive changes in healthcare systems. Whether discussing treatment options with a doctor, expressing concerns about wait times, or sharing experiences with peers, each interaction presents an opportunity to refine language proficiency and foster meaningful connections within healthcare contexts. We really encourage listeners to stay curious, seek out opportunities for language practice, and remain actively engaged in discussions about healthcare access and patient care to further enhance their language skills and make a positive impact in healthcare settings.